Okay, so today we are going to be discussing about cases of miscarriage. So basically, first of all, we are going to define it. So how are we going to define it? We need basically age of viability. Okay, this is the only part that is present in the definition. So that it occurs before the age of viability. Okay. So basically, death of the fetus, or we can say pregnancy loss, okay, that is spontaneous, okay, which occurs before the age of viability. Now, what is this value of this age of viability? It is usually taken as 24 weeks in 10 teachers, but in modern developed countries where more facilities are available, it is usually 24 weeks, but in underdeveloped countries it can be taken at 28 weeks. So age of viability can either be 24 weeks or 28 weeks, but mostly it is 24 weeks. So this is the definition, that loss of spontaneous loss of pregnancy before the age of viability. Now, how is the patient going to present? Now, how the patient is going to present depends upon what is the type of miscarriage, but the main symptoms are going to be that there is going to be vaginal bleeding. Okay, per vaginal bleeding is going to be there, and there's going to be abdominal cramps and pain. Okay, and there is going to be nausea and vomiting, and she can also be having feeling sick and stuff like that. But main things, gynecological symptoms, are going to be vaginal bleeding, cramps and pain, or clots can be passed, or large clots. So based on these, what can be the differentials of this? First, I'm going to be discussing the differentials. Now, these are the symptoms mainly. So, excessive vaginal bleeding after gestational amenorrhea. Let's say that she knows that she is pregnant. So, if she already knows, then her mind is going to lead towards that a miscarriage, because if a pregnant woman undergoes excessive bleeding and passive clots, she's going to think that okay, she might be miscarrying. But if a woman is having gestational amenorrhea, let's say that she stopped having her periods and she did not go to the doctor, and suddenly one day she had vaginal bleeding and cramps and pain with or without clots. Let's just not consider them for a moment. What are going to be the differentials? So the differentials can be an undiagnosed ectopic pregnancy, that can be ruptured or unruptured. If it is ruptured, okay, then the female is going to be in shock, okay, hypovolemic shock, or she is going to be in vitally unstable. She will be vitally unstable severely, and she will have the symptoms of peritonitis. That's the separate case. So mostly in unruptured, these she will be vitally stable, but she will have all these things. Now, next differential can be she can be having molar pregnancy. What happens in molar pregnancy? Grape like structures are passed, grape like clots are passed. So if she already has had an ultrasound which showed a snowstorm appearance, then she knows. But if it is undiagnosed, then it can be considered as a differential of a miscarriage. So these are the main differentials. If you know any other differentials, let me know. Okay, so what happens in this case? So basically, now we're gonna go towards the types. Now, this is the supposed uterus, and we are now going to consider which type of miscarriage it is. So I am going to be drawing a door over here, okay, and this door is present. Let's just consider that there's a baby, okay, present in the uterus, and the door is closed. Okay. So can the baby go outside? No, and the baby is alive. So a live baby, healthy live baby, present inside a room, and the door is closed. So the baby can go outside if the door opens, and the baby can stay in. So there's a threat. There's a threat that the mother might suffer with the loss of the fetus, but it has not yet occurred, and it might not occur. Okay, so if you just ask her to do bed rest, and maybe the door will never open, and the pregnancy will be safe, and she will deliver successfully. So there is a threat. So this is a threatened miscarriage. So what happens in a threatened miscarriage? The baby is alive, so the fetal heart would be present, and the os is closed. Okay, the cervical os is closed, the door is closed, the nothing has passed outside, there's just bleeding. Okay, and also there is going to be definitely vaginal bleeding and pain. All those things are going to be present. So what are we going to do? There's nothing that we have to do. Okay, the baby is alive, is okay, everything is okay right now, but there is a threat of the loss of this fetus. So we're just going to advise her bed rest and counsel her and give her fluids and manage her bleeding. Now the next case is that the door has opened. The door has opened. Okay, the door has opened, and here is the baby. Now once the door has opened, the baby is going to go outside no matter what you do. So it's inevitable now to stop the baby, because the door has opened now, and the basically the baby is also not alive anymore. Okay, so you have lost this and you have lost this. In this case, the opposite situation, so it's opposite to the threatened miscarriage is the inevitable miscarriage, in which the fetus is currently present inside, the uterus is not empty, but the fetal heart rate is absent, because sadly the fetal death has occurred, and the os is opened, and now it cannot be saved, as the name implies, inevitable. So just remember, it is inevitable to close the door once it has opened. Okay, and now the third situation is when the baby has gone. Okay, there's nothing left inside, it's all empty, but small, tissues are present, and the door is opened. Okay, so what is this? Retained products are present. Retained products of contraceptions are present. RPOC, maybe some placental tissue. The baby has gone. So the uterus is going to only have retained products of conception, and there is going to be no fetus. And in this case, the os is open. As we can see that the os is open. What is this? This is basically incomplete. Okay, this is incomplete because the uterus is not completely empty, right? So basically the first two were each other's opposite. Okay, in the first one the door was closed, the baby was alive and healthy, and there was a threat. But in the second inevitable one, it was its opposite, that the door was open and the baby was not alive, and there was nothing that you could do now. Like the pregnancy was the loss of pregnancy was going to occur no matter what. Now in this case I said that the door is open and there are some retained products, and this is incomplete. So what will be the opposite of incomplete? Complete, in which this is not empty, not completely empty, this will be completely empty. Okay, completely empty uterus, and the door will be closed. Why? Because it is complete, it has completed. Okay, the baby has left, the tissues have left sadly, and the door has closed. Everything is just as if there was no pregnancy ever. So it's just the uterus I'm not actually, this actually does not happen, I'm just saying all these things so that you remember these things. Just consider that the uterus has returned to its pre-pregnancy state. It actually has not yet, it yet has to undergo all that in evolution, but as if pregnancy never happened. So this is complete. Okay, os is also closed. Okay, so in threatened, the os was also closed, but you had a normal baby inside. But over here, the os is closed and everything has been lost. So the procedure has been done, completed, and closed. So this is a complete miscarriage. You can only just give supportive treatment over here. So what is, there's one other condition in which there's a missed miscarriage. So what is a missed miscarriage? So in a missed miscarriage, missed means that the mother was not able to identify that something had occurred. It was asymptomatic. Asymptomatic, which means that no vaginal bleeding, nothing has occurred. Why is it so? Because the baby is inside and fetal death has occurred, so no fetal heart. Okay, but the os can be closed or empty, nothing has happened yet. So miscarriage has occurred, but no symptoms have occurred, they are yet to occur. But the fetus over here, the fetus